All right, so I just wanted to talk a little bit about the virtual network communication assignment that is due this coming Sunday. Okay, so I'm not going to read this introduction to you, but it basically explains why you're doing the assignment and the intent. And so please take some time to read that because I think as we've all seen with COVID, this is becoming increasingly more important, and I think providers are looking at all kinds of different ways to communicate with their patients virtually and through mechanisms like this and functionality from the EHR. So uh, take some time to read that. And then what I really wanted to touch on was just some of these assignment instructions and the requirements. And so our focus for this assignment is on secure messaging. And so I'm going to be looking for how you plan to educate providers at a primary care clinic on the use of secure messaging communication with their patients. And so the first thing that you should do is really research secure messaging, what it is, the different forms of secure messaging, the best practices for use in healthcare, and those kinds of things. I think the method that I'm the most familiar with is through electronic health records, of course, um, and and the messaging functionality that's available there through their different personal health records or um, their their record system for patients. And so uh, with that, I would also say that, you may run into, especially at some small provider clinics where maybe their EHR isn't as robust and doesn't have the functionality, that maybe they're resorting to email, right? And so how is that handled securely? And that type of messaging. And so just take some time to research it and understand it and find out how providers are using it, okay? And so what you need to educate these primary care providers on is the guidelines for your institution, right? For your organization. So you're going to be allowing secure messaging in whatever form you decide that it takes, okay? And so what are the guidelines that you want to have your providers follow to use that securely and to make sure that they're supporting um, the patient's health and ongoing care um, by using it according to your guidelines that you're establishing here. Okay. Okay, so the guidelines can take any form that you like. You could develop a policy and procedure that you want to use to educate the providers on. You could develop a brochure, a PowerPoint. You could develop a video, something like this. Um, Whatever you choose and whatever you're most comfortable with, okay? So your guidelines, though, whichever method you choose, needs to address the following elements. So the purpose and benefits of the secure messaging, which you should find lots of information out there on that. What type of information can be communicated between providers and patients? Okay, so can lab tests be communicated? Radiology report results? Um, can cancer results? So what can be communicated? Um, and what do providers have to communicate, right? So maybe it's lab results. Maybe it's certain lab results. Maybe it's results of um, you know, um, blood pressure testing. Maybe it's ongoing um, um, diabetes monitoring, whatever it is. So what needs to be communicated? Um, and then also, I suppose around that, like what do providers need to communicate would be like if you're giving a test result, what other information needs to come along with that? Like the results of this are this, and this is what this means, and this is the follow-up plan, those kinds of things. I think that's probably more what I was getting at. It's still early here for me, so bear with me. Um, and then what are the expectations for providers regarding responsiveness? Is it if they receive a message on Monday morning at 8 a.m., when do they need to respond? What is that guideline? The other thing is what are the documentation requirements for the provider? Does the provider need to document anything about that information obtained or what they gave through secure messaging in the medical record? Or does that information just automatically flow to the EMR? So those kinds of things, think about that. And then lastly, privacy and security. You need to ensure that the information that is being shared back and forth between the provider and the patient, that it is secure. And so, um, and a lot of times providers, they're they may be concerned about it, but it's a lot of time is reassuring them because they're not thinking about technology, they're not thinking about um, privacy and security measures and encryption and all that kind of stuff. They just want you, the person responsible for this application, to tell them and assure them that the information they're sharing is secure. And so just a bit of information about that you would share and use to educate the provider. Okay, so that's really all I wanted to share with you today.